All right, so greetings everyone. Happy Wednesday. Welcome to the School of Global Health Management Informatics, our last webinar Wednesday for the summer series. So just a couple of housekeeping tips before we get started. To our attendees, please be sure to keep your microphones muted and your webcams off. We will be taking questions from the audience at the end. We ask that you use the chat function to submit your questions at that time. We will address them to the panelists in the last roughly 10 to 15 minutes for the open Q&A session. Please also remember that this is a live event and do your due diligence to keep your personal information protected. For any current students in attendance, this is a UCF event, so all student code of conduct rules and regulations do apply. Thank you so much. I'm going to hand it off to our host to get started.
Thank you so much, Jackie. Hello, everyone. My name is Katie Terry. I'm head of the communications for the School of Global Health Management and Informatics and your host for today. I'm so thrilled to have you all with us today as we bring our Webinar Wednesday summer series to a close for the 2021 summer. So today, we're talking with our panelists about the side of the career preparation for healthcare administration and informatics. Getting the degree is only part of the path to success and in the steps and growth in their career. I would like to start off. We're going to introduce my colleagues here at the School of Global Health Management and Informatics. First, you just heard from her, but as a formal introduction, our internship coordinator, Jackie Gonzalez, is not only an alumna of our Master of Health Administration, but also has some industry experience and a great relationship with our industry partners. Jackie, thank you so much for being here today. To get us started on the conversation, what are some ways that you try to help prepare undergraduate and graduate students for their first steps into the industry with internships?
So thank you so much, Katie. So something that I do is our resume reviews and cover letter reviews, as well as some interviewing help. I find that a lot of students sometimes don't have a resume, or they have a lot of questions on their resumes, or they've just found a template somewhere online and they've just decided to use it. And sometimes that's not very industry specific. So I help the students narrow down what they should have on their resume, what's relevant, what's not relevant, what employers are looking for, and how to best communicate that to the future employers. With cover letters, I always tell students, this is your voice in the application process. So take it seriously. This is where we learn about your story. This is where we learn about why you're passionate about the healthcare field and where you want to get and where you've been. And lastly, I do help with interviewing. So I do some mock interviews with students. And as it's funny because some of the questions that stump them are the easy ones, such as name me 3 of your strengths and 3 of your weaknesses.
Gotcha. Thank you so much, Jackie. We will talk about some of this and the ways that you've improved the program and worked with our partners and some of the guests that we've got here today and how that has helped. Next up, we've got Stephen Ten. He is a lecturer here, as well as the counterpart to Jackie as the internship coordinator for the undergraduate and graduate health informatics programs. Stephen has extensive experience in healthcare IT, and we got to hear a little about his experiences and some trends in the industry last week in our session. Welcome back, Stephen. I know you and Jackie work pretty closely on developing the right kind of preparations for students. Are there any differences between the industries that impact how you prepare HIM and HCI students? For example, what types of skills for career success would someone in your programs need to cultivate for a successful internship?
Katie, thanks so much. Katie, can you hear me?
We can, yeah.
Good. And can you see me?
Yes.
I'm having an audio delay on my side. Technical difficulties. This is the problem with technology. We love it. We depend upon it. And sometimes it does. Oh, there you guys are. Okay. Well, I apologize. Well, good afternoon, everyone. Katie, thanks for that introduction. I do direct the internships for the undergraduate health informatics, information management programs, undergraduate and graduate. And to answer your question, are there some differences? My program is a little bit more technical. So there are some key hard skills that the students really have to possess that the employers are looking for. And so I always tell the students, it is these hard skills that will land you that interview, but it's going to be your soft skills that will help you secure and receive an offer of employment. So technical skills with HIM and informatics, you really have to be able to work with data sets. How proficient are you with a computer? And entering the program, perhaps not so much, but by the time you graduate, by the time you get to me, at the end of your program of study, you are fairly proficient. We look for skills in Excel, There's multiple levels of Excel. We all know how to use Excel, but I think we use Excel maybe 2% of the power of this application. So I highly encourage the students to take on additional courses, to get intermediate, even advanced levels of Excel, because any work in data analysis, machine learning, artificial intelligence is going to start with looking at data and normalizing data and transforming data in a way for us to be able to ask it intelligent questions. So really enhance those hard skills that you have by making sure you have key competencies that are relevant today on your resume, and also develop your soft skills so that when you get that offer for an interview, you can land an interview and get that job.
Thank you, Stephen. The technical aspect of your program is definitely the primary difference between the two. But, I agree, the cultivation of those soft skills and the professionalism are going to be across the board, which I'm really glad that we'll talk about some of that information today. So moving on into our mentorship and leadership development side, we have our executive in residence and associate lecturer, Shannon Elswick. Shannon has years of high-level healthcare administration experience and is an active member in the American College of Healthcare Executives, or ACHE. And he is definitely one of the many of our faculty with that in-depth knowledge and imparts as much wisdom and advice for our students as he can. Thanks for being here today, Shannon. Some of the key points we try to focus on outside of the academics are networking, internships, involvement, and volunteering. Can you tell us a little bit about why these things are so important in building a career path?
Sure. Thanks, Katie, and welcome to everyone who is here, and thanks to our fellow panelists for their time today. It's critical. I'm someone that looked at who knows how many thousand pieces of paper that people were trying to sell themselves over the years. And for me, it was always critical that, I was looking for well-rounded people. So a GPA of 4.0 is impressive, but if that's the main highlight. So when I'm coaching students, and we do most of our intensive career development through our MentorPod program, Jackie was a member of that. We have some very energetic students that work through that program. But we talk about, we do mock interviews, we do resume reviews, we do all that stuff. But we talk to them about, being well-rounded. Students that don't have any background in healthcare don't have to get a job in healthcare to get experience. You can volunteer, get your foot in the door. The secret is in the interview, if you say, what I learned in school was, that's not as good as saying what I observed in the hospital when I was volunteering was. We also talk to our students about, fundamentally understanding that, people don't buy what you do, they buy why you do it. And you mentioned stories earlier. Those of you who may be TED Talk geeks may recognize Simon Sinek in that quote. So we talk to people about, why are you doing this? Why do you want this? And can you tell that story? So cover letters and personal statements become very, very important. But also it goes to networking. And the American College of Healthcare Executives is the premier place, in my opinion, at least on the administrative side, for networking with mid-careerists and even senior executives. So we try to get our students engaged. The students that are successful at fellowship applications are generally the ones who were highly engaged, who did networking, who took volunteer positions in the committees on ACHE, and used that experience over their 2 years in the program to gain confidence and poise and enhance their communication skills. So like Stephen said, like Jackie said, it's an awful lot of what's behind the curtain once you get that first piece of paper to the second desk. So the resume is the first stage, but once you get to that second desk, a whole new set of skills kicks in. And we hope that our program is really beneficial to students in that regard.
Thank you, Shannon. We were definitely going to talk a little bit about that, talking about getting to that second desk, because we've got a couple of those second desk people with us today. Super excited to talk about that. With that, it's a perfect segue. It is my absolute pleasure to introduce Kathy Dixon, Director of Health Operation and Optimization at Orlando Health, who is one of our amazing intern preceptors with our health administration program, as well as Elizabeth Fuentes, the Learning and Development Consultant of Organizational Development at Advent Health. another awesome preceptor that works with our health informatics student interns, and Stephen. Kathy and Elizabeth, welcome, and thank you so much for being here with us today. I'm just going to dive right in with the questions. Kathy, I'm going to start off with you. You are one of our health administration alums and actually a two-time UCF alum. Can you give us a brief look at what your journey from HSA graduate to present day director looked like?
Absolutely. Thank you, Katie. And I'm very excited to be here. Sorry about that, guys. I'm very excited to be here with you guys tonight because we have taken many interns from UCF in the same program that I had the pleasure of graduating from, and it's been remarkable. And so my journey is actually kind of unique in the sense that when I went through the HSA program, I actually was employed with a totally different organization. I was with State Farm Insurance, and I spent 10 years handling medical insurance fraud. And so I went back to school. I got my HSA degree, loved the experience. I did it while I was working full time. I call those the dark years. I got through it, got it done. And then the next thing you know, I said, well, gosh, I don't want this degree to get stale. If I want to go back and do something that's more provider supporting or on the provider end. And so I reached out to my industry mentors. It sounds so cliche. I know how it sounds. Get a mentor. Get a mentor, they say. Well, I had two. I had one that actually had more of an informatics background, like I'm sure we'll hear from Elizabeth. And I had one that actually was a hospital administration background. So I just started reaching out to them to talk. Like, I have a full-time job, guys. I'm not reaching out to you for a job, but I don't even know where to start. I don't know what the sector looks like today. I don't know what to do. And I just kind of started talking to them and coaching with them. And the next thing I know, there was a job description that came my way from Orlando Health. And it had all these buzzwords on it that I had no clue what they meant. Population health, value-based care, clinical integration. I had no idea really what those words meant. An idea, but was I prepared to sit in an interview and answer questions associated to it? My mentors came in, they helped prep me for it. And so 6 years later, I got the job at Orlando Health. It's my honor to now be our director of population health and value-based care. I learned it all on site. I leveraged my resources. I learned it on site. And like Shannon has said, your background and all of your experiences, you draw upon those and apply it to future roles, wherever they come from. They're called transferable skills. And so leverage your resources and your mentors and have faith in yourself. And the HSA program was remarkable for me. And I have thoroughly enjoyed being a preceptor for many successful interns that have come to join us at Orlando Health.
Thank you, Kathy. It definitely is great to hear a similar experience from someone who's made it to your level working with our students, so you can impart that same knowledge and just drive that home. Elizabeth, similar to Kathy, you actually graduated with a degree in sociology, and that's one thing we really encourage our students is highlighting how one path does not always lead the direction you thought. So tell us, how did you go from sociology to your career now?
Yeah, so I kind of feel like the odd person out. And first of all, I just want to say thank you so much for this opportunity to be here. And hello to all of you who are tuning in. Really, I feel like I was kind of everywhere. But I want you all to kind of take my story as what happens when you don't have wonderful programs such as these internships that can lead you along the way. I mean, you can find your way, but it just takes a little bit more. So I have, just to give you all a little bit of an overview about me, I have over 10 years of healthcare experience. I started in a small owned pediatric dental office, really working with insurance and administration. I then joined Moffitt Cancer Center as a patient access representative, where I did a lot of the registration and scheduling for patients. And I don't know how many times I always go back to that position, but I'm so grateful for it because it really gave me a perspective of the clients, the patients, the why am I here? And I think that's really important when you're working in healthcare, is always remembering that why. And I think when you have that at the forefront of everything you're doing, it really does shine in the work that you do. I found that I had a bit of a tendency to do a lot of mentoring and educating throughout the process. You know, when you find yourself kind of being that same person over and over again, it's like, oh, Elizabeth, you should mentor this, or you should do this. Question that, you know, and just be like, you know, it seems like this is leading me somewhere. So I took my the information that I started learning on EHRs and applied for a training position where I trained on Cerner for a couple of years. And in there, I really found what I loved the most was to educate adults. And it really was in those soft skills. So when you're talking about how you need to really perfect those hard skills, like, yes, be really good at what you're doing with the technical skills, but go ahead and I encourage you to learn a little bit more, to grow, to really bring those soft skills into play, because the way you connect with people, the way that you can make that difference, I think, in what you do is in those connections. And that's really where those soft skills come into play. So I had the privilege to join Advent Health in January of this year. So if you ever want some feedback as to what it's like to be onboarded completely virtual, let me know and I'll give you the details. But yeah, it's been an amazing process, and now specifically working with our IT team. And I've had the honor to work with Stephen. Although our partnership is not that long, I feel like we're making some effective partnerships and connections for the interns. So that's a little bit about me.
That's excellent. So, you know, you touched on a couple of really important points. What would you say is the most important, if there is only one, that people looking to make the transition into the industry should think about or do? Other than that, why?
Specifically, transitioning into that, besides the why, I would look into your strengths as well. So I kind of pointed that out through my experience. You know, I noticed that there was a knack for something, as I would call it, and listen to that, because I think you should always partner what you hope to do in your life with something that does come in a way naturally to you. You might need that help in cultivating it. And that's really where going to school, learning more, getting those mentors, getting those connections can really help you. Volunteering, having that experience that Shannon talked about, I think that's important when making the transition, and the exposure, because that's the only way you're really going to know. And that's where I think the internships really help in assisting people thrive in their careers.
I can totally see why you and Stephen work really well together. A lot of the similar philosophies. That's awesome. Kathy, so we'll dive a little bit deeper into your experience. Not only does your role support systems responsible for 275,000 covered lives, but you're also a preceptor for our interns, like we discussed. Don't even know how you accomplish this, but can you give us an overview of what an internship at Orlando Health looks like with you?
Absolutely, and they've looked a little different. And I know Shannon knows several of the remarkable students that I've had the benefit of working with. And so we don't try and fit a round peg into a square hole. When we take on an intern, it's the tasks, the assignments, the initiatives that we assign them to are literally what we are working on in current day. And so we are a clinically integrated network. That means we have to stay on top of healthcare trends and making sure we produce relevant performance information for providers. We're trying to achieve the quadruple aim. That means that we're trying to improve quality and outcomes while reducing healthcare costs and spending. By doing those two things, we think we're going to improve the patient experience. And then in order to do those three, we have to support our providers. So those are our 4 pillars. And so some of the things that our interns have been able to experience have been like drafting policies, actual policies for clinical initiatives like human growth hormone, which is a medication that's only used in certain instances, lower back pain imaging, you know, when is it clinically appropriate to order a radiation scan depending on the patient's symptoms and history. Sometimes we do patient campaigns. It's not very often, but As a clinically integrated network, if we want to make sure some of our populations are adherent on certain medications, specifically statins. Statins are a little difficult to get compliance with a population. Patients don't generally want to take them. So sometimes we send letters to providers or even patients. They might help with outreach campaigns like that. Network newsletters, we have to communicate with our network of providers. We produce the annual value report, which is actually publicly available. If you Google Orlando Health Network and go to our website under resources, actually it's the About Us and Results. You'll see it in the Results tab, value report. It's where we showcase all of our performance year over year. Our interns help us produce some of that content. And, it's truly whatever we're working on. And if we're going to stay one of the leading clinically integrated networks in the Southeast region of the US, each semester will look drastically different.
For sure, definitely. So Elizabeth, similar to Kathy, you juggle your responsibilities as well as bringing on and managing our interns. So what does an internship project look like with you in your department at Advent Health?
Yeah, so it looks it's very different. I think where the partnership with Stephen really comes in is I get to tap into what he really knows about the interns, and what I come in, or where I come in the picture, is just, okay, this is what's available, this is what they're looking for, and kind of trying to partner it with what would be the best fit. And of course, there's never like that perfect fit, but we want to find more commonalities, not just is the skill there, but is the culture also of the organization something that would help this individual thrive? Is this something that they can relate to? Because again, going back to the why, I think where people are most happy and most successful in their career is when they can look back at their organization, they look back at the mission, they're like, yes, I relate to that. So that's really, I think, how the process right now is working, and it's thriving. And where I come in is just really checking up on our interns, like, how are things going? Have you heard this? Okay, let me get you connected, talking to their preceptor. And again, just managing back and forth. And yeah, that's been it. So constantly looking for ways to improve. And if that's the trajectory that you're going to go next, I think one of the ways that I would like to see our program improve more is just by getting more of the feedback from our interns and perhaps the departments that they work with. Because even though I know I'm going in with the best intentions to make sure this is a successful pairing, and so is Stephen, there's nothing that replaces like that personal experience that our interns are going through. And I think in getting that can help us a little bit more with future experiences.
I think
Can I chime in really quick?
Yeah, for sure.
I just wanted to say, Elizabeth, thank you so much. It's been such a pleasure working with you, and you having our students at Advent Health. And I also wanted to mention one of the soft skills that I would like to see all my students exhibit that you just exhibited now, which is humility. You are so wonderful, and you don't seem to let that go to your head. So I just want to say that how much I appreciate the partnership. One of the things that Kathy had said that I think is very true, we don't try to fit a square peg into a round hole. It really comes down to me on the UCF side, knowing our students, knowing our talent, knowing what their natural affinities are, what they want to do for their internship, and certainly what they want to do post-graduation. And if they don't, to have a conversation with them, sit down with them, whether it be virtual, it used to be in the office, but it's been more virtual recently. And certainly to gauge some of those soft skills as well. I want to make sure that they're ready to go out and represent themselves, and certainly represent me and the program and the school when they're out doing that. So I have a communication with Elizabeth, and then Elizabeth is the expert on the projects and her teams and her culture on her side on Advent Health. So we have this partnership where we communicate, and it's a good communication, and we try to make it a strong two-way fit. We find the right student for the right project with the right preceptor. And so it has been successful for many years, and look forward to many years to come.
Thank you, Stephen. You both bring up a really good point. Stephen and Jackie, you did talk earlier about the preparation work we do and provide for our students. But as Elizabeth mentioned, there is the feedback factor too, right? So Kathy, what are some challenges that you faced bringing in interns? For example, what are some areas of opportunity for future interns to take note of? And what would you say exemplifies a successful internship?
So it's been interesting, to continue to do this over the years. There have been some opportunities that we identify, and sometimes it's right up front during the interview and resume review process. And so, Jackie told you how important it is to get all that stuff right. But I always say that your resume and your cover letter, that's your ticket to the ball. Once you get your ticket to the ball, you got to show up and be ready to, wow the room. And so one of the things we've started to do to kind of help with the selection process is we've actually started asking students to provide us with a sample work product or a final deliverable, and then we review that up front. And so if you provide someone a sample work product, please come to the interview prepared to speak to it because there's nothing a little more strange than us knowing more about the spreadsheet or PowerPoint that they provided to us, and then not really being able to answer follow-up questions. And particularly if it wasn't your deliverable, like you were working in a group, but you only produced the very last slide, say that right up front. The last slide was mine, but I helped with the creative part of this process and I can speak to it. Just come prepared to speak to it, really. So that's interesting. And then, like you said, if I could give advice to future interns, it would really actually boil down to something that's very, very simple, and it's be a good communicator. And what I mean by that is, again, it sounds so cliche, right? I'm full of those tonight, but everything goes back to that. And so even in that interview process, right, if you are asked a question and you try your best to answer it, and then in the back of your mind, you have that little notion, that little inkling or alert that goes off and says, I don't know if I answered that, or gosh, I think I went off on this tangent. There's a reason why your spidey sense is going off. And to be a good communicator, you would then offer that and finish your thought and then say, did I answer your question? I want to make sure I did. If you need me to elaborate, I'm happy to. Or if you know you didn't, then you say, I don't have a great example for what you're asking for, but if I can perhaps reframe that, I have something that comes close. Then you're showing self-awareness and all of those things. And so communication will get you farther than many of the other practical implications of actual real world experience. And that'll take you very far in all of your careers. And then my other piece of, go ahead.
Oh, I just wanted to add something, but I'll let you finish, Kathy.
Well, I was just going to say the only other thing I could think of is to be resourceful. And so anytime you come into a new role, whether it be an internship or a new role in your career, you're going to be given an assignment that you know very little about. You might be given very little direction. And so whoever assigned that to you is going to appreciate seeing you use some critical thinking and being resourceful. And that can involve just dissecting it, breaking it apart. And even if you can push 1/4 of that project through, even a little bit, it's better than coming back to that person with nothing. And even if that includes Googling, I didn't know what this term meant, so I Googled it and I found this other organization does this. Is that the direction you want me to go in? Even that is better than starting with a blank or coming back with a blank canvas. And then back to you, Elizabeth.
Oh, thank you so much, Kathy. So I think you hit on some really great points, and kind of back to that communication, you touched on it even with being resourceful. I mean, I hope that you all feel empowered in knowing that it's okay to ask questions, or if something is ever said to you and it's asked in a way that you don't understand, it's absolutely okay to ask, hey, can you please reword that in a different way, or can you say that differently? Because at the end of the day, I know that the preceptors who you will be working with, all they want to make sure is that you're walking away with a clear message. Don't worry about, I have to know everything. Put that aside. You're there to learn. And I think that when you walk in with that sort of attitude and you look for that clarity, people are so much more eager to work with you. So that was just one thing.
Elizabeth, thank you so much for bringing that up. That's one of the biggest things when it comes to the internship. This is a learning process. And so asking a question during the learning process is expected. No one's going to look at you and say, well, why are you asking a question? No, the internship is the learning process on the job. So thank you so much for bringing that up. Actually going to jump over to Shannon. I'm going to, just for a second, from the CEO, CFO perspective, because you've got that high level. Many of our master's level students have current experience and are wanting to make their way up to positions like Kathy and Elizabeth. What are some challenges or areas of opportunity for those moving up in their industry?
Well, I appreciate all the feedback so far. I will tell you that what I tell my kids, whether they're my children or my kids, like Jackie's one of my kids, she wouldn't admit it, but my kids at school, to get to the next level, you always need to be in the top 10% of the current level. So you're looking at the people around you, and that doesn't necessarily mean from a technical standpoint, you have to be the smartest, but you have to be the one that people instinctively turn to when they have that thought of who should I ask to do this? And that has so many skills. And let me just touch on a few that we've already mentioned. First of all, communication skills, and communication skills are not just verbal. In my course, we've really pushed this, and there's a lot of class participation, but it's physical, it's eye contact, it's poise, it's confidence. All of those things are the things that move you from, you got to the second desk, like you got your invitation to the ball, now you're at the ball, but you're not going to dance with the prince unless you can be in that top 10%. Kathy also mentioned value. And I think that's something that's critically undersold, that I talk to all the people that I mentor, put it in my guest lectures, but everyone should have a value equation. I didn't make it up, but the one I use is value is equal to quality plus service divided by cost. And too many businesses say, I'm going to increase value by reducing cost, and they don't understand what that does to service and the quality. The way that you want to produce value for the people you're working with in the internship or the job you want is to bring additional quality or additional service to that organization without increasing cost. And as people begin to understand that, it makes so much difference. Stephen mentioned humility. That is one of the pillars of a level 5 leader. Jim Collins wrote extensively about that, and it's research-based, and it's absolutely true. Elizabeth just talked about ask questions. If you ever worked for me in the old days, or if you ever took my course, you know that I put in everything in writing. The time to ask a question is when you first wonder whether you should or not, because that indicates I'm interested, I want to learn, and learn the things that you're going to need to use. Here's an example. Interviews for jobs are going to say, what do you do about conflict? Give me an example of when you had a conflict situation. So if what you say is, well, what I think is I should do this and I should do this, that's great. But if you do the research and do your homework and you say, hey, I read Franklin Covey's, 6 steps of conflict resolution, and they really resonate with me. And in the interview, I can say my personal approach is very similar to the Franklin Covey approach, and it's this, and this. So, all of that goes into, it's actually a sales job, right? You have to sell yourself to get in the job. And once you're in the job, you sell yourself to be in the top 10%. And then once you get that call, people begin to say, hey, that's the person. So we want to be the people that other people instinctively turn to for answers to their questions or for help with a project. And just like I was just coached, I'm going to say, does that really answer your question, Katie?
It does,
Well
as a
done,
matter
well
of
done.
fact, it does, definitely. You're great at practicing what you preach, Shannon, and I appreciate that. It's funny that you say something about it being a sales job, getting to do all of these webinars, meet our partners and all of the like amazing people that we get to work with. I've seen a lot who their journey started out in customer service and sales. And so to your point, it's like they really have taken those soft skills all the way up to those positions like Elizabeth and Kathy. So that definitely slides in there. Jackie, speaking on that, I know you work closely with Kathy and hundreds of other preceptors and partners for our health administration programs. And, preparing our students means knowing what our preceptors need. As, we've asked Elizabeth and Kathy, can you share with us the process you put in place to get this feedback and improve our internship program for our partners' needs?
So usually I always try to speak to the preceptors or like a new site. That's a big thing for me. That communication piece is really huge. Just kind of knowing what they need, what they're looking for, what their expectations are of the students. Sometimes it comes into, they'll ask me, well, what can the students do? That's actually like a really big one I get a lot. So there has been some things that I've kept examples of things that students have done in the past with the permissions of the students, of course, because they've produced some amazing work. And lately, I've actually put into an easy, just simple survey tool of who do you want the students to apply to and what are you looking for? For a long time, since there's so many partners and students, it's been a challenge to try to figure out who needs what and kind of when. But I've realized when you streamline things and when you put it into a simple just form, basically just asking the preceptor, what are you looking for? What are their preferred qualifications? What strengths do the students have? Is there any weakness that you'd like to help the students with? So solidifying that piece and actually, I've been working with Stephen on a new software called In Place, which is a whole internship platform. And eventually we'll move everything into that, which is great because it streamlines the process even more. Thanks, Stephen.
I can't wait.
It's been a work in process for sure, but it's definitely been really amazing just to see the whole implementation process for a whole new software.
I mean, it's a great thing too, because I know a lot of our organizations like Orlando Health have made the switch over to Epic systems. So we're getting a little bit of that, comparison of what they're going through just with the new system and ours. Talking about getting their feedback, how does it translate from getting the feedback from the preceptors? Then what's that like preparing the students?
So when it comes to the feedback from the preceptors, I say this is like a performance evaluation because we all have to do a performance evaluation on the job. And it's one of those things where I do ask that the preceptors speak with the students about the performance review because it's a very important piece. And it's very interesting to me, the students that I've seen come through, they had no idea sometimes that this was something that they needed to work on because no one has told them in the past. And I've definitely learned you don't know what you don't know. So it's a wonderful piece when the preceptor has to give that feedback to the student. And in turn, the student says, oh, I didn't know how to improve on this. And now they know that this is something that they can work on.
It sounds like you've taken the advice of everyone here about communication and really throwing that down. And that's awesome. Stephen.
Can I chime in too?
Yeah, please.
I feel I'm interrupting too often this evening.
No
Well, I just wanted to mention that one, I completely agree with everything Jackie said, but that feedback is critical in every project, in every implementation, and really in everything we do. It's that feedback that gives us information to make improvements. With our internship process, and ours is nearly identical, Jackie's and I. We ask for feedback both from our students and also from the preceptors. And the preceptors will give us critical feedback for the students, which they can work on, improve their own skills, but they can also tell us about the skills and the competencies and the areas of interest that they're needing in industry so that we can hear that in real time, so that we can then modify our curriculum, train that workforce so when they come out that they're familiar with the Cerners and the Epics so they can be employable. Enhancing employability is what it's about. So we continually collect that feedback every semester. How are our students doing? How is their analytical skills? Are they able to work on your business intelligence teams? What are the products that you're working on and you see yourself working on in the future that will need our talent to work on? So we take that and we refine our curriculum, and we ensure that we produce highly competitive, qualified students.
Yeah, on that, Stephen, you had talked earlier, you and Elizabeth both, about how you collaborate back and forth on essentially, okay, this is the type of intern we need, and this is the kind of skills that they need. What stands out to you, or what does a student need to exhibit to you for you to be like, okay, I'm going to refer this student over the other one, even though they have the same technical skills?
That's interesting, because although my programs are very technical, it comes down to the same core quality professionalism skills: integrity, honesty, the ability to convey that you can be trusted and others can depend upon you, very strong communication skills, and a willingness to learn. I think any student who comes to me, and really GPA almost doesn't matter. If you come to me with a strong desire to learn and a strong work ethic, and I believe that you are sincere in your efforts, I'll stand behind you and support you. And we've seen many students who, on both sides, with very impressive GPAs, not perform in industry. And on the flip side, students who perhaps haven't had the very best academic record be the all-stars. And so really, I want to see the students come to me and be sincere, have the right attitude, exactly what Elizabeth said. You have to have the right attitude. We don't always have great days, and we don't always have the best prior experiences. But if you can frame your experience in a positive light and show appreciation for the successes and the failures that you've had in the past, that's what employers are looking for. So strong communication skills, the right attitude, strong work ethic. Absolutely.
Nice. I definitely agree with you on there. Kathy and Elizabeth, on that, I want to have you just think for a moment about if you could condense your advice for future interns or careerists in one sentence, what would it be? That, or a lot like Stephen, what does the wish list of skills for a great intern look like? While you both think on that, I do want to let everyone know we're headed into the open forum Q&A session. I'm just reminding you, use the chat function. You can send in your question to the chat and I'll present it to the panelists for answering. Okay, so I'm going to go ahead and get started with you, Kathy. What would be your one sentence advice for a future intern, or a wish list of items for a great intern?
So I kind of spoiled that for us earlier with start with good communication, be resourceful, and then I always like to look for critical thinking. It goes hand in hand with resourcefulness. And critical thinking can, expose itself in very many ways. And sometimes the best interns we have come to us, either myself as their preceptor or other folks on my team, with new ideas and strategies that even we haven't thought about. And so I guess that's a self-starter attitude. And so those are the things, like if I just had to pick a few, I'd say the top ones that have stood out for me all were able to demonstrate.
Thank you. What about you, Elizabeth?
Okay, so I really thought hard on, what would be something that I would pass on. And I had actually wrote something prior to this. So my thoughts were, be always open to learning something new with gratitude. I think that's a really key thing. And many times I think we're placed in a position where we are going to learn something new, but we may not take the right attitude with that. So always think gratitude. Because I think it will help you see just how fortunate in many situations you are, and you'll be able to take a lot of the good in that. Also, just never take for granted the professional experiences you may acquire wherever you are in your career. So in my past role, I got to be for the Big Brothers, Big Sisters program that we had. We had a little partnership there, and we had high schoolers in their junior and senior year there. And they're getting ready and they're like, should I have a resume? And they're like, well, I work in a retail job. Like, really, how is that going to apply for me doing this role here? And I was like, well, what do you do? And they were like, well, I work with people. And I was like, that's very important. So what do you do when you work with people? And just trying to highlight all those different things that sometimes you take for granted. All of that is going to help you for good. So I think everything that you use in your life can be used for good if that's the perspective that you choose to run with it. So I think that would be my advice there.
Yeah, for sure. You know, that taking for granted, everyone has touched on the fact of that mentorship, and you can get that anywhere you are, whether that is working in customer service. I think it was maybe 2 weeks ago, one of our webinars, one of our Fulbright specialists, which is a really big deal in academia, who works for our global, she talked about how her first job was folding T-shirts at Sports Authority, and now she's one of the most respected in her field, doing these Fulbright scholarship, researching healthcare and the minority communities and all of that in another country. So this is you need to take those skills from there. So I definitely echo that. Kathy, another question for you. One that I get pretty consistently with students is, how to juggle everything. What was the toughest part of your career path, going to college and then getting to where you are today?
Juggling doesn't get any easier, and it doesn't. And then it's just going to come down to how you find personal workflows that work for you. To be honest with you, for my personal life, I still use a paper planner. And for the longest time, I went back to the UCF bookstore and bought the UCF planners because it had all the football games in it for me already. But I still use a paper planner for my personal life. Now for my work life, I am completely paperless. I don't want any paper. I get something for work that's paper, I scan it, and then I save it in a folder somewhere. But my personal life, I haven't gotten there yet. So juggling is going to be what works for you. I leverage a lot of Microsoft Outlook. I had somebody that I worked with in a past life who showed me a few tips and tricks that keep me organized in my calendar. And I still carry those forward today. I've shown them to other people, including interns, that have said, I love this. It makes it so much easier in adopting it. So I'll give you a teaser of one of them. When you have an email up, there's quick steps in the center of the window. One of those quick steps says create an appointment. If you click create an appointment in the quick steps, it will actually take that actual email, put it as an embedded object inside a new invitation appointment window. You can set yourself an appointment and that little email will be tucked inside there. Call it whatever you want. Set it as a reminder for yourself to pop in 1 week. And then 1 week later, if you haven't heard back from that person, you open your reminder and there's the email. You just pick it right up and send it right back to that person. And so I have a color system. Everything in Outlook is color coded for me. I know what all those colors mean. So I see it and I know automatically whether it's an in-person meeting, a virtual meeting, an email follow-up, something I need to work on personally. Those things just come with time. So my advice to juggling is start with a process. You're going to change your process a million times over your career, but start with something, test it out, tweak it as you go, and then ask the people that you come across that you see as being good multitaskers, good organizers, ask them, how do you stay on top of all these things? And then you'll just gather all these little tips and tricks, and then you'll mold them all into this amalgam of what works for you, and then impart that wisdom on others. So best advice I have.
Elizabeth was just talking earlier about having gratitude and not taking for granted. I have learned so much in these webinars. But Kathy, let me tell you that little tiny piece of advice, I think you literally just changed my life. That's amazing. We do have a question. So this is actually pretty common amongst our students. How do you handle the scheduling of an internships for students who are employed full-time already? I guess maybe Jackie and Stephen, if you want to kick this one off first, and then we can ask Kathy and Elizabeth.
Sure.
So
Ladies
we get
first.
this. Oh, thanks, Stephen. I get this question a lot, and I know Stephen does as well. It's one of those things where there are options if you're working full time. There are places in hospitals that are open 24 hours a day, such as the emergency room. So there are opportunities there. There's urgent care centers. There's nursing homes. There's a lot of different options while you're working a full-time schedule. Also, there are options when you're in the actual internship orientation. This is getting a little bit more into internship orientation, where if you are working for a healthcare facility and we are not affiliated with them, that's an opportunity as well. As long as you can work for a different department and a different supervisor, it's something that we can definitely talk about when you're in internship orientation. But honestly, I remember what it's like to work full-time and go to school and have an internship and have to juggle everything. Dark days, Kathy, very dark days, lots of coffee, but you make it work. You really, truly, honestly, you make it work and you know you're going to make it through. Stephen?
Thank you, Jackie. So for my undergraduate program, we recognize that this has been somewhat of a challenge, completing 160 hours in one semester. Now, the graduate students have to complete 240 hours in one semester. And that certainly is a challenge. Many of our students are working professionals. So full-time work, full-time school, probably a part-time schedule. So we have been able to really work with our partners to develop flexible schedules for internships. Much of IT has been virtual even before COVID. And so I allow my students to do remote internships or hybrid internships where they show up a couple days a week and they're able to be integral with their teams and join meetings. And then after that, they can VPN into their networks and do their work from anytime at all, whether it be at night or on the weekends. So we try to be flexible. There are many strategies that we employ to ensure the students are successful in their projects. We want them to be successful so they can graduate, but we also want our preceptors and our community to benefit from their work. So it has to be a win-win. And one of those ways is to really be accommodating with that schedule. I have the students for 2 semesters, and so does Jackie. We have orientation first, which is 1 whole semester, and internship. And we tell the students right up front when they join our programs. The master's program is a 2-year program. The undergraduate program is also a 2-year program. So right up front, we say, budget your time. If you have paid time off, start saving it. If you don't have paid time off, start saving just time off. And know that this is a commitment that you have to complete in order to graduate, and you want to fully embrace it to take advantage of this opportunity. Those students who can embrace it fully translate more into becoming a full-time employee. So we can work with the students. If I can start you sooner, if the site is ready to host you sooner, we'll start you sooner. So we can give you more than 16 weeks, maybe 20 weeks, maybe 24 weeks, but we'll work with you. If you join our programs, in the 6 years I've been doing this, I have yet to have a student not succeed in their internship and miss graduation because we couldn't work with them on a schedule.
Definitely. Elizabeth, I did get another question from a student. This kind of pertains to your guys' side, yours and Stephen's. Is it okay if I want to work on an internship that I'm not confident in, but I want to learn about it? For example, a project on EHRs.
Personally speaking, I would say yes. We do open that experience. And of course, with the communication with Stephen, I think just in letting us know that ahead of time, that will help us. But I know there's many leaders at Advent Health IT that are willing to be preceptors and give opportunity. I mean, it's so exciting that we have this internship program, and you won't even believe just the feedback that we get from leaders. Like, do we have any interns? Because we think this would be a really great opportunity. Do you know if anyone would be interested? I mean, it's there. So I would say yes, if it is something that you want to learn. And even if you're like, I'm not sure, but you want to get that exposure, that can be a possibility. Just let Stephen know and we can make that work so that I can prepare the leaders.
So Stephen, piggybacking off of that, what would you say would be the most important thing for people to know if that's the situation they're in looking for an internship? So if they're not familiar with it, not confident in it yet, but they want to learn about it, where would you say that hard line would reside?
Well, this is very common. The health IT space is so broad. There are so many areas of expertise. And so it's not uncommon that we have students who get right through the program and get to me and sit down with me to say, I don't know where I belong, because it's all been within the classroom. And so it's not until you actually go out and apply these skills and actually kind of walk in the shoes of an informaticist or a data analyst, do you find out, where you actually fit in, where these affinities actually exist for you. And so we have had just wonderful partnerships, and our partners have, just like Advent Health, have allowed some of the time in the internship, perhaps even the first 40 hours, where the student isn't locked into a particular department or a project, and they float around. Data flows through the entire health system Every department touches the data. And so if my student has any interest in, say, HIM, and maybe they go over to informatics, maybe they go over to release of information, maybe they go over to pharmacy, they can kind of bounce around a little bit and get a feeling for where they think they belong and which teams they think they get along with the best. And so we are quite flexible. I tell the students, don't worry. It's quite normal to be at this stage and still not know where you are, but spend some time reflecting, figure out what you don't like, because that also helps quite a bit, because if you can tell us what you don't like, we can help steer clear of those areas. The undergraduate HIM program has a heavy emphasis on billing and coding, and we'll have students who come through at the very end and say, Stephen, I really don't think I can be a biller and coder. I can't sit in front of a computer every single day looking at numbers and putting in ICD-10 and all that. And I get it. I completely get it. And it's a safe space that you tell me this so that we can avoid that type of experience and kind of focus on the informatics side, which is the other side of that program, and maybe explore EHRs, maybe explore some of your other interests within HIT. So we're flexible with the opportunities. We really appreciate the flexibility our partners give us to let our students float around a little bit and find out where they want to be in the future.
Thank you, Stephen. I'm going to do one last question, Shannon. What is one thing that students could do today or this week to take their next professional step?
Well, again, first, you have to have an awareness of what your opportunities are. All of us have talked about communication and the soft skills and how you present yourself and confidence and poise and how important all of those things are. Those are the things that move you to the next level. There's so many things that you can do, from Toastmasters to networking with fellow students to joining HFMA or ACHE. I would say Ben Zander, who with his wife Roz wrote some really good leadership stuff. Ben was the conductor of the Boston Philharmonic, but Ben said, throw yourself into your life like a rock in the pond and watch the ripples. I think, that's probably as close to a top line as I could get. You've got to jump in there. And yes, we're all busy, and yes, there's multitasking, and yes, we're working full time. I started as an orderly, decades ago. I got my degree working full time as a hospital corpsman in the Navy. Every other weekend, we had 20 hours of face-to-face classroom every other weekend for the time it took me to finish my degree. And I complained and I was grouchy, and my poor wife had to put up with all that junk. But it was that effort and that drive, and it was just, jump in there. And when somebody opens a door for you, walk through that door. Don't stop and say, I don't know if I'm ready. Opens doors mean walk through that door. So it comes down to throw yourself into your life and be successful.
I love that, Shannon. Thank you so much. So that brings us to the end. Really quickly, thank you to our panelists, Kathy, Elizabeth. You're such amazing partners in our program, and we're super happy to hear you today. I can't wait to have you back with more in-depth on careers and moving into those different things in the future. Thank you to my colleagues, Shannon and Jackie and Stephen. Everything you do makes our students better. And thank you for the attendees and those watching online live. We love having you here. Got the information up here. If you want more information on our programs or to talk about the internships or any of that, please reach out. And again, thank you everyone who joined our series this term. This was a great way to end the summer series for Webinar Wednesday. And I will see you all next year. You guys have a great